Hi everyone. Today we are honored to have Dr. Lewis from Costa Rica, Dr. Sylvia from Dominican Republic, and Dr. Raul from Mexico, and Dr. Pablo from Argentina. They are all candidates of the Brachial Plexus International School program. This actually is a comprehensive program that is designed to provide in-depth training for diagnosis and treatment of brachial plexus. And participants usually have the opportunity to rotate among 4 centers in the world and 4 different countries to gain experience from those 4 centers. So today they will going to take us in a short journey about this brachial plexus program, and we will give us more information about how exciting this was for their learning journey. Hi everyone, nice to meet you all.
Nice to meet you.
Nice to meet you too.
Okay, thank you. So maybe we'll start first with Dr. Lewis and ask what was the spark that made you specialize in the brachial plexus field?
What is a part?
What made you specialize in the brachial plexus field?
Why? Because always I have interest in brachial plexus since I finished my residency in orthopedics, and I live in Costa Rica, and in Costa Rica there's no too much information and there is no management of brachial plexus lesions. And there is a part that always give me a special interest in that part, and I see the deficit in my country about this topic, and start to looking for people, professionals that are good in the topic. I found Dr. Clifton and his group, and I made El Diplomado. The first part of the course was in the north part of Mexico, in a city called Torreon. And then we make a specialized program that is the Master in Brachial Plexus, and was an amazing experience, because you can take experience and the knowledge of many peoples, many groups, many ways to take the same objective, is to rehabilitate the people with this problem. All people and obstetric lesion or childs. Usually in Costa Rica, in my practice, I am in the hospital that we have adult patients. We work with traffic accidents and problems with workers. Okay. And I manage usually adult brachial plexus, traumatic brachial plexus.
I see. So the higher load is more to be an adult rather than obstetric.
Yeah. It's very rare to see. In my case, it's very rare to see an obstetric, but it's a very good. It's a very interesting kind of patients.
Yeah.
But in my practice, usually I don't have this kind of patient. I only have adult trauma.
Yeah. Okay. What about the others? Is it the same also for you all? Like you have more adult than obstetric in your countries?
Yes.
So in my country, it's more adults, because I work in a public hospital that is only for adult patients. We don't have any child there. Okay. But in my private practice, I also see some kids, but they are all late in the age.
Yeah, sometimes this is the issue of the obstetric, that they usually come late.
Exactly.
Yeah.
Yeah. In my practice, I see mostly adults, but in the group with Dr. Clifton in the jornadas,
in the meetings.
In the meetings, yeah, or in the journeys, every 2 months we saw adults and also
obstetric also. Yeah.
Okay.
Hello. Well,
Hello.
in my case, I work in a children's hospital in Buenos Aires. So we see a lot of babies and also sequela of OBBP. So that's a week practice. We have kids every week, and also I do also adults. So I do both.
Okay, that's great. Okay,
so we have a very amazing.
Yeah, it's Yusuf. Yeah, hi Yusuf, nice to meet you.
Hi, nice to meet
you. Hi, thank you. How are you doing? How's your fellowship?
Yeah, so I didn't recognize you with the.
Yeah, so I got older maybe since the last time you saw me.
Yeah, how's it going?
I'm good. How's your fellowship?
I'm done with the fellowship now, but everything's going fine.
Good. Long time haven't seen you.
Yeah.
Good to see you now. So, okay. So yeah, I'm just having a short interview with them for the American Society of the Peripheral Nerve regarding the international Brachial Plexus program they had.
Oh, yeah.
Okay.
Good.
Yeah, thank you. So now my question to Dr. Sylvia. So how did you get to hear about the Brachial Plexus International School?
No, because we did the diplomado. It's like a course that we go every 2 months in Torreon, Mexico. And then Dr. Clifton was in my country and we heard about the diplomado. And then we took the diplomado. And after that, it was the first group that went to the international school. And then it was a second group. I was part of the second group who did the master.
I see. Yeah, so just the continuation of the journey. Once you enroll into this diploma, you can just continue for the masters.
Yeah, it's masters most of the times.
But also people can go into the master without going into the diploma.
Exactly.
The diploma is not necessary.
Yeah, but usually it's the people that have a background in brachial plexus surgery. You don't have to have a diploma, but you have had experience. It's not for initial people that want to make a surgery in brachial plexus. It's for people that have a background in these topics.
Exactly.
Yeah, I got it now. Thank you. So moving to Dr. Raul, so among all the cases you have seen in the 4 different centers, what was the most challenging case that you still remember till now?
I don't know. I'm not sure because every case is complicated or interesting. But I would say that maybe total brachial plexus injury, every patient with total brachial plexus injury is a challenge. Yeah. Mostly when they don't have any roots. So in order to, for reconstruction, this is the tough case. Yep.
Yeah. Okay. Moving to Dr. Pablo, so how did your practice got influenced by those 4 different centers experience?
Well, I think my practice changed completely because initially we went to India where we saw adults and babies surgeries. We saw total brachial plexus injuries in adults, contralateral C7. Then we went to Egypt where we saw a lot of pediatric patients and sequela. That is most of the practice I do nowadays. Then we went to Spain, Barcelona, and then to Mexico. So after that, I was at that time a volunteer in a children's hospital in Argentina. And there were a lot of patients there that were coming with brachial plexus injuries. So this exposure during the education that I have in Mexico and then with the master was the thing that allowed me to try to take care of these patients. Before this training, it was going to be impossible for me, and I think it was as any of us. I think is one of the objectives is that to have more brachial plexus surgeons around the world to be able to take care of these patients. That's one of the big objectives of the master.
Yeah, I agree for that because they're usually quite challenging case and long journey with the patient himself. Okay, so now we ask Dr. Lewis about what was the most challenges you have faced while moving from one country to another, and how did you overcome those challenges?
Could you repeat me? What's the most challenging? What?
The challenges you have faced while moving from one country to another, trying to adapt to the new country, to the new center.
I don't know if I understand what is.
De ir a un sitio a otro. ¿Qué es lo más retador para ti?
Yeah, I guess it was the language. I guess the language was a very big barrier, and the customs of the country, because in Latin America we have some customs, one way to relate with other people, and this relationship could be different in any other countries, and in any other countries, around America, you can communicate very easy with other people in Spanish or English. But if you go to another areas of the earth, you have a very big problems to communicate to the relationship. A lot of barriers, and mainly about, with the language, but other barriers that you can sometimes you have done the custom to take it. The food is another thing, but you can
Can adjust yourself.
try. It's very interesting, I think. Yeah, but sometimes for a few people it's a big barrier, but it's very interesting.
Yeah, okay. So mainly was the language barrier.
Yeah.
The customs.
Yeah. Also, is not difficult, but it was very funny. Like traveling in a rickshaw in Pune with all the transit there in India and the way of driving. It was kind of scary for us. You know?
Yeah, I'm sure there are quite different cultures you have been among, but I'm sure it is quite good experience for you all.
Yeah, amazing experience. Cultural also, because you learn from other cultures. And also you learn how things are done in other countries with different resources. And you can also take those things from different places to your own home, you know?
Yeah, for sure. You bring a lot of experience back. Yeah. So for Dr. Sylvia, like, how important do you see this program has changed your practice after you got the masters of the International Brachial Plexus School?
I think it was amazing. It was important, very important, because this is like the beginning and the development of my practice in brachial plexus. It was without this master is different, and with it we can I can reach more patients, and also more technical surgical techniques to do surgeries of this kind of patients. And I think it was a big challenge also to go there, but it was a big knowledge that we could learn in the master. Every country show us a small part of the brachial plexus work. It was in one country was child only, children only, and in another country was only product. And in every part, it was a new knowledge and a new techniques and new ways to approach the patients.
I see. And all the four centers, they allow you for hands-on. Oh,
Yes.
okay,
Yes.
that's good. Okay. Yeah. So, Dr. Raul, like, what do you advise the surgeons who are interested to enroll for this brachial plexus masters?
What the advice what?
To enroll.
To enroll. I think that all the aspirants to the master should have some knowledge about brachial plexus surgery. Yeah, because there is a lot of high concepts, high knowledge in the cases and the professors that they're gonna take more approach to the master if they have some knowledge of brachial plexus. I think so.
Yeah, okay, I agree with that. So my last question to Dr. Pablo, like, how was the social life in the 4 different countries?
What was the
Social life.
The social life.
in different countries?
Yeah, but they only took us like
No,
outside,
it was
dinner.
like in India. We went to a temple. There was a festival for Ganesha, so we were all there enjoying, music, clubbing. It was very nice, and very spiritual also. That thing. In a suite, we went to visit a very old place where a cave where Mother Mary was. So it was amazing, and also the culture there is very incredible to be exposed because you are in the center of Egypt, so not so much tourism, and you see the true culture there. Very nice. And we went also to Europe and to Mexico, so you enjoy different cultures, different foods, different ways of living, So it was very, very interesting and very enriching. I don't know if that is the word.
But still you enjoy the social life despite the language barrier.
Yes, of course. Yeah.
Okay, that's
we can communicate. Yeah.
Okay, that's
in
great.
English, in Spanish, in Egyptian English, in Indian English, in any.
Osama, I was the only one who doesn't speak Spanish.
Okay, it is their turn to treat you back while you treat them for Arabic in Egypt. Okay, thanks you all for your time, and it was really an amazing interview with you all. So I hope to see you again in one of the meetings soon. Okay, goodbye. Enjoy your day.
Bye.
Bye. Bye. Bye.
Thanks.
Thanks.
This is for the American Society.
Oh,